and working now to protect mothers and children in Georgia is Dr. Stephen Palte with UnitedHealthcare of Georgia. Thank you so much for joining us, Dr. Palte. And we wanted to talk to you about maternal health. There are so many concerns in the United States with pregnancy-related deaths that are considered preventable. Can you talk to me first about the work UnitedHealthcare is doing to help lower those mortality rates?
Well, there are a number of programs that are in place, but the one that we're very proud about is our doula program, where we do allow doulas to assist pregnant mothers throughout the journey of pregnancy. Obviously, pregnancy can be a very stressful time, but ideally, we would like it to be a joyful time. It really is a great opportunity, and we'd like to decrease the stress and increase the improve the outcomes from pregnancy.
Such an important goal because you're right, pregnancy is stressful, it is hard, and the more support a woman can get, the better. Can you talk a little bit about what a doula brings to the table? What is their role and how do they help support moms?
Sure. So a doula is really a non-clinical person who is there to assist the mom throughout the pregnancy and even after the pregnancy. They're there for questions. They're there as an advocate if the mom feels that she doesn't quite know what questions to ask or feels that a question may not be well received. So the doula is really there as the advocate, but they also provide advice regarding pregnancy and things that could go wrong in pregnancy and ensure that the mom gets the treatment they need, gets the antenatal treatment. They're there during the delivery if needed, and it can also be help after the delivery with things like breastfeeding. And the doula can either be in person or they could be virtual. So there are really a lot of options to help support the mother.
Yeah, that support is so important. Can you talk about how doulas could address some of these mortality rates?
Sure. Well, it has been shown that with doulas supporting pregnant mothers, that there is a decrease in cesarean section rate. There is a decrease in neonatal ICU admissions for the babies, and also, even more importantly, there's a decrease of about 57% in anxiety and depression after delivery. So really, they have a lot of benefits to offer to the pregnant mother.
What does the expansion of this service mean for families here in Georgia?
Well, this means that for families in Georgia, we do have the benefit. Obviously, every healthcare provider is different, and it is important to check the back of your insurance card and call your insurance provider to see exactly what the benefit is. But it is something that is widely available to our customers in Georgia.
What's the feedback that you hear from moms who have the ability to work with a doula or have that experience?
Always a very positive experience. I was just speaking to actually a dad today who said that his wife had a doula for both of her pregnancies, and he said that it was the most amazing experience, both during the pregnancy and after. And he was a very great big advocate, and said he would speak to anybody and advise him to use a doula because it really does enhance and improve the pregnancy experience.
I love that. I know doulas are linked to fewer C-sections. Could you explain that link? Why is it that moms get fewer C-sections if they have the support of a doula?
Well, often, cesarean sections are done for emergencies that occur. And one important part of the doula's function is to ensure that the mom gets the necessary antenatal care, because obviously getting routine antenatal care and picking up those issues early can reduce the need for an emergency cesarean section. So they really do help with helping the pregnant mother, get as close to term as possible and decreasing that cesarean section rate.
What message would you want families to take away from this initiative?
Well, just to think of the doula as a support, not replacing the medical care that you're getting from your physician or your midwife, but actually as a support to help you and to be an advocate for you and to really assist in those difficult decisions that can occur during pregnancy and relieve the stress, make it a joyful time.
All right. Thank you so much. We really appreciate your time.
Okay, thanks for having me.